Hi, everybody. I'm Babs, and welcome back to White Knowledge is Power, Understanding Racism in America and Why White People Should Know Black History. Today, I want to talk to you about three incredible young Black women. Their names, Lucy, Anarcha, and Betsy. To understand why these women are national and global treasures and responsible for life-saving medical treatment for women in today's society, I have to talk to you about this terrible man, Dr. James Marion Sims. Sims is known as the father of gynecology. For those of you who don't know, gynecology is the study of the female reproductive system. Dr. Sims invented the vaginal speculum and a life-altering procedure to fix a vesicovaginal fistula. If you've never had a pap smear, a vaginal speculum is the tool that they use where they insert it into a woman's vagina and it spreads it and holds it open so that the doctor can perform an examination. A vesicovaginal fistula is an opening that develops between the bladder and the wall of the vagina. This was a common occurrence in the 1800s after childbirth. This causes urine to leak through the vagina. It's painful, embarrassing to go through, and if left untreated, it can lead to death. Sims's medical training, which was standard at the time, was an internship with a doctor, a 3-month course, and a year at a medical college. Once he was trained up, he started practicing. After his first 2 patients died, he moved to Montgomery, Alabama to set up shop. Once Sims was operating in Montgomery, he would basically lease enslaved women and experiment on them. At the time, vesicovaginal fistulas were a common occurrence, and although he experimented on quite a few women, the 3 that are known by name today from his notes and his autobiography are Lucy, Anarcha, and Betsy. These women weren't given a choice to say no to this experimentation at all. Dr. Sims, all he had to do was get the slave owner's consent, and that was that. He wrote in his autobiography that, quote, "There was never a time that I could not, at any day, have had a subject for operation," end quote, and that it was the most memorable time of his life. Seems like a real stellar guy. It's extremely important to note that Dr. Sims operated under the belief held by many at the time, and still a relevant viewpoint in today's medical world, that Black people don't feel pain the same way as white people do. That they have some kind of higher tolerance or thicker skin that makes the pain different for them. He also believed that Blacks were less intelligent because he thought that their skulls developed too quickly around their brains. He would operate on Black children using a shoemaker's tool to pry their bones apart and loosen their skulls. Now that we know the type of man we're dealing with, let's get to the heroines of this story. Lucy was an 18-year-old who had given birth and couldn't control her bladder. She underwent an hour-long surgery where she was brought into a room naked in front of a dozen other white male medical professionals, restrained to a table so she couldn't move during the operation. She was screaming, crying out in pain the whole time. No anesthesia, because of course, once again, they thought Black people don't feel pain or feel it in the same way. And even Sims notated in his autobiography that her agony was extreme. She became violently ill after the procedure and contracted blood poisoning. She did recover, but the actual operation to repair the fistula itself was a failure. The second woman, Anarcha, was a 17-year-old enslaved woman who had had a very traumatic labor and delivery over the course of 72 hours and developed the same fistula. He ended up operating on her 30 times in the span of less than 5 years. 30 surgeries without anesthesia in under 5 years. On the 30th attempt, she did end up having the fistula fixed and she made a full recovery. The last young lady was a woman named Betsy, and I wasn't able to find as much information about her, but she underwent the same procedures and torturous processes that the other 2 went through, and many others that he experimented on, once again, without any pain medication or anesthesia. So not only did these women have to go through the agonizing pain of these operations and the recovery afterwards, Sims ended up training them to be his assistants to operate on other patients as well. And he also taught them how to care for each other after surgeries. In all, he operated and experimented on these women for 5 years before they were just sent back to their slave owners. It's thanks to these women and many others like them that we have the medical advances and knowledge that we do today. The inequity of healthcare is still extremely relevant in today's world. The belief that Black people don't experience pain in the same way as white people is still a belief held by portions of the medical world. Reports have shown that Black patients receive less pain medication for broken bones and cancer, and Black children receive less pain medication than white children for appendicitis. So I want to thank Lucy, Anarcha, and Betsy, and every other Black woman and person who had been unwillingly experimented on in order to advance medical studies. Our world is literally built on the backs of Black people, and oftentimes without their consent. I hope this video gave you a new perspective to think about and shed light on why some Black people may have an inherent distrust of the medical world and doctors. They've been used and abused for so many years and not listened to or believed when they talk about their own experiences and what's going on in their own bodies. So thank you for watching. Like, subscribe, share this video, and most importantly, let's end racism together, and let's believe Black women.